distinguished guests, friends and family members of Dr. Mitra, students of Dr. Mitra, and everyone else present here. At the first, I'd like to congratulate DGFT for introducing this annual memorial lecture in the memory of Dr. Mitra. I also take this opportunity to compliment Dr. Sri Rupa ma'am for setting up this research foundation in the memory of Dr. Mitra and choosing domains of education, health and environment for research. We are so pertinent in today's time for our society. My association with Dr. Mitra has been during his time in Ministry of Home Affairs. We used to have meetings where we used to discuss how do we apply these different digital technologies in whether it is criminal justice or say internal safety and various other aspects which Ministry of Home Affairs deals with. One thing which I very distinctly remember, Dr. Mitra was very firm believer in power and potential of technology, how they can really transform governance, be it internal functioning of the government, or be it managing government programs, or be it delivery of services to citizens. And therefore, he used to always outrightly encourage us, outrightly support us during all these interactions in taking these digital initiatives forward. As was also mentioned, he also always brought a lot of component. He was a big academician and he always used to bring those other aspects that how technology should be efficiently and judiciously used into these domains when we are trying to specially bring it into the lives of people. With AI, data and mobile and cloud, we are now going through another transformation of technology-led transformation as far as governance is concerned, primarily to give a new level of experience to our citizens when they're trying to interact with government or they're trying to avail government services, or when it is internal functioning of the government, how do we bring this data and bring this data-driven decision making? How do we really use these models of AI to be able to predict or to be able to really bring in what is the right way to implement these policies, or early detection of frauds and risks and so forth. So there is a huge potential. Education and health are another two important domains where AI is not really coming into science or lab. It has now become mainstream. We have started witnessing the use of AI into these domains as well as other domains of e-commerce and all also. During COVID, you all have already seen how much of a remote education or remote schools or technology-led delivery of education. The national education policy of the government has a very huge component of technology, that how technology should be used to really deliver this equitable, because in our country we really have, how do we really provide quality education to each and every child at the place and of his residence or at the remotest place in the country. And with a kind of scarcity of teachers and to be able to give, the technology becomes one of the big savior and can really perhaps catalyze this whole thing in providing universal and equitable and inclusive education. Similarly, health is another domain. We have been always long, we all know that we have a very skewed ratio of doctors versus patients. And as you move from metro cities to tier 2 cities, to tier 3 cities, to districts and villages of India, the problem becomes more and more challenging. You really have this quality health care into those hinterlands of India is still a challenge for us. And there again, technology becomes a big, I should say, a big catalyzer that way. Government has taken a lot of initiatives in terms of reaching. We have seen telemedicine coming onto this. But AI is now bringing another dimension. And the good thing is we have already started seeing use of AI. I personally see AI not only as giving a quality education, but to be able to give equitable kind of health care, quality health care, even in the tier 2 or in the remote parts of. How does it happen? Because if you see, one thing you have seen, the AI assisted diagnosis, detection of this thing from the medical imaging, be it diabetic retinopathy, be it breast cancer, be it tuberculosis, is now becoming, their accuracy is becoming better day by day. And this can really assist doctors to be able to, even those doctors who are not so skilled, to be able to detect cancers, to be able to detect diabetic retinopathy. These are diseases where if you get delayed or if you lead late to the expert, you many a times are not able to recover, or the cost of treatment becomes so high and with the much lesser chances of survival. But the same thing, if it could be diagnosed at an early stage, the not only survival rate becomes very high, the burden of treatment also becomes far less. And with AI kind of models, that will be possible. We already have seen a lot of works happening in big hospitals in India as well as elsewhere. And I think if these models proliferate and democratize and reach, the machines embedded with these models reach, they can really make a lot of difference and can really help us, address the scarcity of skilled staff into district hospitals or into sometimes primary health centers and things like this. You need machines or you need models to do this thing. Another important thing which we are seeing is that the use of AI is in terms of this robotic surgeries. When you have robot assisted surgeries, the precision of the cut is very, very fine. And as a result, you get less stitches, your recovery is faster, your stay in hospital is less, and which has, as you say, that really has a lot of catalyzing or cascading kind of effect. So that's another thing where AI is playing a big role. Generative AI is not only in governance but in healthcare. Generative AI is basically which you have chat GPT. You are now able to see voice assistants or chat bots which can not only provide customers the health information, it has the ability to provide you this information in any language you feel like. So that language barrier which have been out, all these things, many a times, when patient goes to the doctor prescribes, then patient, because he's not able to understand English, which doctor is mostly speaking, he has to need somebody's assistance outside to be able to understand क्या medication लिखा और उसको कैसे consume करना. Even for that, they need sometimes a kind of assistance. So with this chat GPT kind of things or chat bots, this problem of follow-up of the patients or to be able to get further information about their disease and how they have, what kind of care they have to take, it can really help. And it is, believe me, it's already happening. Only thing is it is not really that widespread, each one of us are consuming, but it's beginning to happen. And that is the domain we have to really work more and more. Because the basic part of AI models is some of them may have been developed in Western countries or in some other countries. Now when we use it, they may not be 100% correct. They may still show false positives and all. Therefore, we have to customize these models to our context, to our countries, to our demography. And therefore, we have to use, what is needed is our hospitals have to use these models and they have to adapt it to our circumstances, to our kind of genetic structure or whatever you may say. And therefore, implementation of these models, using of these models and training of these models is critical. And once we are able to do and come to a level where they start giving us 99% something of accuracy, they can be really used to really improve our healthcare in a big way in terms of especially in the hospitals. The healthcare of similarly, if this operational or technology healthcare in terms of healthcare, we have a big problem of this senior citizens or elderly people. So care of elderly or the critical care of people with chronic diseases, again these kind of technologies can play a big role. and the kind of application, mobile app which has been launched, this is a step in that direction. Because when you have a patient into these ICUs or CCUs and things like this, one, in any cases, you should be able to get basic parameters about, vital parameters about the patient's video and all, but more importantly, it can really help in creating alerts, because all hospitals are not that equally staffed on 24/7 basis to be able to really monitor. The fatigue of doctors in our country is very, very high because the kind of shift duties they have to work. So in all these circumstances, these kind of devices or these devices supported or augmented with patients' data and AI models can really assist our OT staff or ICU staff or CCU staff in providing much better quality of care to these patients who are there, and can really help in avoiding any kind of incidences as we had tragic incidences we had so far. So therefore, I really feel we should have, this is a very good initiative. I like to compliment all the young students who have taken this initiative and wish them all the very best in their future. And I really encourage many of you here to be taking these kinds of initiatives and building more and more these kinds of apps and models into these areas, because if we all work and do different initiatives, lots happening in our country to start up this thing, but I think a lot more needs to be done. So with this, I like to really thank Shri Rupa ma'am for having me here. It's been a real honor. Thank you very much.